We open every implant box with the same belief that what's inside is perfect, clean, biologically neutral. But the truth is darker. Independent audits have exposed implants arriving with carbon layers, machining debris, organic residues, and microscopic metal particles hidden on the very surface that it's supposed to integrate with bone. And the body does not ignore these contaminants. It reacts, sometimes violently. Today, we're going to expose the uncomfortable story behind the Clean Implant Foundation and what their findings really mean for your implant success. After 30 years in surgery, I've learned one brutal truth: biology always wins. On this channel, we do not just talk about implants and graft, we study how the body fights back, how we can work with it instead of against it, what the evidence actually shows, and how disciplined surgical systems turn chaos into predictable outcomes. Welcome back. Today, we're diving into the hidden world of contaminated implants and the organization that exposed it. This begins with one man, a German dentist named Dr. Dirk Dudek. He saw a pattern that did not make sense. Clean surgeries, good stability, correct protocols, yet early failures and unexplained inflammation kept appearing. Most blamed the patient or the surgeon or called it bad luck. He did not. He suspected something no one wanted to believe: that implants might not be as clean as manufacturers claimed. So he bought implants, multiple brands, multiple batches, and sent them for independent analysis. When the images came back, everything changed. Under scanning electron microscopy, the perfect titanium surface transformed into a landscape of contamination, machining debris, metal particles, carbon layers, organic residues, and massive inconsistency from implant to implant. This was not an accident, it was systemic. That is when he founded the Clean Implant Foundation, a non-profit organization with a single purpose: to reveal the truth about implant surface cleanliness with zero commercial influence. The foundation performs independent audits using scanning electron microscopy, elemental analysis, organic contamination testing, and batch consistency reviews. Brands that pass receive the Clean Implant Trusted Quality mark. Those that fail publicly. This is not cosmetic, this is biology. Contaminants on implant surfaces trigger macrophage activation, dendritic cell priming, a surge of inflammation cytokines, and a shift away from osteogenesis. You see the implant, the immune system sees the threat. Microscopic particles disrupt fibrin adhesion, interfere with platelet behavior, slow osteoblast recruitment, and destabilize early osseointegration. The long-term result is even worse: a low-grade inflammatory state that increases the risk of bone loss and peri-implantitis. A clean surface is not optional, it is the foundation of predictable healing. When the foundation released its first images, the industry was shaken because the problem was not rare, it was everywhere. Premium systems failed, unknown systems passed, batch variability was real, and sterility meant nothing. The message was clear: not all implants are equal, and many are not clean. Let us pause. The foundation exists because one surgeon refused to accept unexplained failures. Independent audits revealed real, clinically relevant contamination. These contaminants directly alter the immune response, early healing, and long-term stability. Next, let us look at what this means for your implant choices. Choose implant systems that undergo independent clean implant audits. Do not rely on marketing claims. Rely on evidence. Stop assuming that higher costs equals better purity. It does not. Add surface cleanliness to your implant selection protocol. Make it a non-negotiable criterion and track your own outcomes. If a system consistently shows delayed integration or early crestal bone loss, question the surface, not your surgical skill. The Clean Implant Foundation forced the profession to face an uncomfortable truth. The greatest hidden variable in implant dentistry may not be the bone, the graft, or even the technique. It may be the contamination sitting invisibly on your implant surface. Contamination is silent, invisible, but to the immune system, it is unmistakable. Choose implants that respect biology from the first second they touch bone. Your long-term success depends on it. If you want more videos exposing the hidden biological forces that shape implant and grafting outcomes, subscribe and activate notifications. Thank you for watching.